Hi everyone, I am Jamie and this is Batman and this is, I don't know if you could see her, it's a robin ear, she's camouflaging, yep, there she is. I have been traveling the past few days, so that's why I have not done a video, but while I was traveling I was thinking what advice I can give to people with chronic fatigue syndrome or anyone suffering from any sort of illness to help them with their trip. And I have been on planes and driven long distances since I have had chronic fatigue syndrome, and I have found some things that have been really helpful, and I have also made some mistakes that have set me back a little bit. So I'm hoping that I can give you some tips that you'll be able to use. So there are some tips that I can give that both cover plane and driving a car. So I will start off with that. So for both of those, what I would suggest is that you pack up to a week or at least a few days ahead of time. With this disorder, you really need to save your energy with everything that you do. So when you're going to be taking a trip, it's nice for the first day or two before the trip that you can rest. So things like clothes and things that you aren't going to pack the day of the trip, such as a toothbrush and toothpaste. Everything else I would try to pack about a week beforehand, and you can save your energy. That's very important for me. And something else that's really important is to bring a copy of your medical records in case you go somewhere and you see a doctor. It's helpful that they know that you have chronic fatigue syndrome, and if you have any other disorders, it's helpful that they have your recent labs. And it's a lot easier when you're in that situation to just have a copy of your medical records instead of having to call the doctors and have them fax everything over. And I have done that before, so I've made that mistake and learned that for me that is a lot easier just to bring a copy. And something else for both trips is to bring your own food if you are on a special diet, and to try not to sacrifice that just because you're taking a trip. A lot of people with chronic fatigue syndrome are on diets such as the paleo diet or gluten-free, sugar-free, may have food sensitivities. And I also made a mistake on this trip by bringing a cooler with me while driving, which was great, but it wasn't a big enough cooler, so it was a 2-day trip and it just had enough food for 1 day. So bring what accommodates your diet with you in a cooler that fits the amount of days that you're going to be going. Make sure it's a big enough cooler, and then if you're on the plane, just simply bring the food on the plane with you. It'll just make you feel better if that diet is working for you. Since I ate all my food that was in the cooler the first day, the second day we were only passing gas stations and none of that food accommodated my diet, so I still had to eat, so I just didn't feel as well because I had to get some of the food that didn't accommodate my diet. So that's it for what you can do for both of them, but now I will talk about what you can do if you are going on a plane. And so my first advice for that would be to consider the benefits of a nonstop flight and a connecting flight. And for me, I like to do a nonstop flight because it's just easier for me not to have to get off. And once I'm kind of sitting down, I like to stay there for the remainder of the trip. The con of that can be that it is a little more expensive sometimes, but for me that really outweighs getting really a lot sicker having to get on a connecting flight. But everybody's different, so some people, if they're going to be on a 5 or 6 hour flight, may want to stretch their legs and be really uncomfortable being on a 5 or 6 hour flight and may need to get off and relax and stretch. So definitely just don't pick anything. Think about what is going to work best for you. And another important thing is getting a wheelchair for the flight. with chronic fatigue syndrome, like I said, you really want to save your energy. And I had a personal issue with this when I first started taking flights when I was sick, and it was just embarrassment and maybe pride issues, and I felt like I was just really afraid what people would be thinking because I had my two chihuahuas with me. It's an invisible illness, so I looked healthy and relatively like young, and I was in a wheelchair, so I felt pretty spoiled with these chihuahuas. And in a wheelchair, they push you past everyone, and I'm like, oh, do people think that I'm faking it? And the thing is, it does not matter what people think. You don't know these people, you're not going to see them again. Doesn't even matter if you did. You're doing what's best for you. You know that you are sick, so I highly recommend that. And what's great about that is that they'll push you to the gate that you are going to. But what I would still do, since nobody's perfect, is double check and make sure that you are at the right gate. And that's just the kind of, for my brain fog, I just like to kind of double check and make sure that I'm in the right place. And another thing that kind of comes with the wheelchair that's really helpful is that you usually pre-board. And what I would do also is ask, just to make sure, because sometimes, I mean, you never know. It depends on what airport you're at. Sometimes they just leave you there and kind of forget about you. But what I do is ask and make sure that I can pre-board. And not everyone needs to do this, but it works for me because since I have chronic fatigue syndrome, I move in slow motion, so I feel like I would just hold people up, and who knows, might be really uncomfortable, and I just take a long time, and it's just easier if I go and do that first. And then also people can like help me put my luggage overhead, and other people don't necessarily need to see that. I could just do that in privacy when I go on board first. And another thing that's very helpful is to have your meds with you, because the flight may be longer than expected. You might be in pain, something might happen, you might have to take your supplements or medications at a certain time, so definitely have that with you. And also, something that I just found out that's really cool is that pharmacies will actually, if you have a liquid medication, they will put it in little bottles for you. You can always do that yourself, but the pharmacy is willing to do that, so that's pretty awesome. So that actually concludes everything for the plane flight. Let's talk about driving. My first piece of advice would be to drive with someone, and one reason for this is that they can help you drive, and another reason is that it's just someone that can make sure that you are doing okay, and this greatly benefited me on my last trip. And also, I would let them know about your health condition and what the symptoms are, so that if something happens, they know what to do. And this really benefited me because when I was driving at one point, out of nowhere, just because this illness is completely random, I started getting really intense shooting head pains, and I was like squinting, and I was like, ah, oh my god. And the person that was driving with me, she didn't think I was crazy, I don't think, but she knew that it was one of my symptoms, and she knew what to do. She said, can I help you with anything? And she helped me get my medicine out, and I took it to feel better. So that was really, really helpful. So if you can, I definitely recommend having someone drive with you. And speaking about meds, I recommend having it at the front within reach, especially if you're driving by yourself or even driving with someone. Just always have it up front. And also plan your hotels ahead of time, because you never know what can happen, and it may take you longer for you to take your trip than you expect. I didn't know if my trip was going to take 2 or 3 days. So let's say, this might be a weird way to put it, but let's say I'm going from here to here. I didn't know if I was going to be driving 2 days if I felt well enough to, or 3 days if I needed to space it out a little bit more. So what I did is I planned and inquired about a hotel that was in the middle, and then I also inquired about hotels that were 1/3 of the way and 2/3 of the way. And also, speaking about hotels, this actually goes to my last piece of advice is it, and also going back to if you have a special diet, I would call the hotels and see if they have a fridge in the room. And I'm on a budget with my hotels, and so a lot of times the ones that I can afford don't have fridges in the room, but you can always ask if you can keep your little lunch pail or cooler in the fridge in the lobby or by the front desk, and they have never said no, so I would definitely inquire about that. So I hope all these tips have helped you. Actually, one last thing, always listen to your body. If you need to pull over and you're driving and rest, do that. Be honest with the other person. Let them know how they can help you. Just be open, let people help you, and listen to your body. That's actually the best general advice that I can give. So I hope that this helped you, and I hope it can help you in the future on your trips, and I will see you guys next time.